evening. Tonight we present the program we've been promising you on cancer. One of the most feared words in the English language. It means sickness, tests, treatments, side effects, and death. Doctors tell us that if we live long enough, we will all die of cancer. Then what is long enough? To get old? To see our children grow up and have their own children? To retire, if we could afford it? And to have done all the things we have always dreamt of with our families by our side? We believe that our attitudes have a lot to do with this terrible word, and when we get it sooner rather than later, we must deal with it. Hopefully, this story will be of some help. No, not a magic pill, but not a death sentence either. Medical science has done a remarkable job in asking us to live longer and to be more productive than even our parents were. Why, when I was born in 1939, I was expected to live until I was 54 years old. In December, I will celebrate my 73rd birthday. And the mortality tables tell me that I could live another 14.4 years to age 87. Wow! That would allow me to see my grandchildren grow up and get married. My story begins with this young man, about 8 years old, who had recently come from a far-off land to grow up in America, a place where life can be as good as you want to make it and where you do not have to live in fear. This boy was going to go to school here and pursue his dreams of helping this world become an even better place. Many, many years later, after 5 children and 4 grandchildren and a career that spanned 50 years serving his clients, he suddenly went from being a somewhat healthy person to a patient who had to make choices because he had prostatic cancer, which can be fatal. He could fight for his life, but he could not wait. A good friend who was also a doctor said to go to Henry Ford. "The best is there," he said. The chances to regain a normal life are great, and here was a place where the patient gets the care and the caring. This last thing was important because when you get sick or are told you are sick, even without pain, it's a terrible place to be. You're scared and lonely. You want to be heard, comforted, and treated with respect. Most of all, you want to get well. Your families are most important, and you can't explain everything that's happening to you. You need and get their support. But they can't be there all the time, and as much as they want, they can't take the fear away. What they can do, and mostly do, is comfort you, and often act as the in-between when it comes to getting the information that you don't understand. It's only fair to give you some background on all this. Auto pioneer Henry Ford established this hospital, which is an 815-bed facility that specializes in acute, specialty, primary, and preventative care services backed up by research and education. It's a teaching hospital and boasts the finest doctors and staff that attract patients from all over the world in their mission to improve life through excellence in the sciences and the art of healthcare and healing. Recently, they won the Malcolm Baldrige Quality Award, a very highly desired and deserved honor. From the moment I drove up for my initial consultation with the oncology department, everyone was kind, courteous, and caring.
Good morning.
Good morning.
Welcome to Henry Ford Hospital.
Thank you. Thank you. Thank you very much. No one wants to be here. Fear of the unknown courses through your body, and your legs have turned to jello. As you enter the reception area, you already feel that this place is different.
Hello. Hi, how are you?
I'm fine. My name is Ralph Stillwell. I have an appointment here today.
Okay, we just need to see your ID and insurance cards, please.
Sure.
Thank you.
Absolutely, they are.
Okay, and who's your emergency contact person?
That's my son Sean.
Okay, then you can have a seat over here. You're welcome to have some coffee or tea, and the nurse will be right with you.
And you start to get a feeling of welcome instead of the cold, unfriendly greeting that you get at most doctors' offices and clinics.
Mr. Stillwell,
Yes, ma'am.
my name is Benita. I'm one of the nurses here. If you can come this way, I'll take you to the room.
Fine, thank you. How are you today?
I'm well. How about yourself?
Fine, thank
Good. You're going to be seeing Dr. Walker today?
Yeah, that's what I'm told.
Okay, so we're going to go right this way to our left.
We pass by a wall of pictures that show the staff from all over the world, and we proceed to go and visit with the doctor. Now, I may have to wait the usual 15 minutes to half an hour, but wait a minute, she's coming right now.
Hello, Mr. Stillwell. I'm Dr. Walker. Pleasure.
I'm glad to meet you, ma'am.
Nice to meet you.
Thank
How are
you.
you doing today?
I'm doing fine.
Good.
I'm doing fine.
Good. Well, let's sit down and talk a little bit. You've been diagnosed recently with prostate cancer, and of your various options, one was radiation, and you decided to undergo radiation.
That's
so,
correct.
what I'd like to do is review how radiation is given, what the expected side effects can be in the process of radiation. And at the end, you can ask any questions that you may have relative
Sounds
to
fair
that.
to me.
So, in general, radiation is a local treatment that is directed at the organ, in your case prostate, that we want to treat. So therefore, where your side effects will be locally around the area of the prostate. And radiation is using high energy X-rays to kill cancer cells. Now, how does radiation do that? Well, it affects the reproductive part of a cell. So we've all heard of the DNA in the nucleus of the cell, how it reproduces. So the radiation affects both the DNA of cancer cells and the DNA of normal tissues. But because cancer cells are growing uncontrolled, they try to reproduce without fixing any damage because they have no controls. Normal cells, however, when they get damaged, they fix their damage before they reproduce. So that's how we get selective killing between the cancer cells and the normal cells. Okay? So the first step in giving you radiation is something we call a simulation. That's the planning part. Think of it as the dry run of your treatment. So generally what happens is we give you an appointment, which I will give you at the end of today, to come in for your simulation. At that time, we're going to lay you down on an X-ray table, such as the diagnostic table here in this room. You'll be laying flat on your back. All our simulators are specially made CAT scanners that you don't have to give any IV contrast for. We lay you down there, and what we're going to do is we're going to scan you from about just above your belly button to just below your mid-thigh area, because that's the area where the prostate is, and we want to be able to identify the prostate and all the organs that sit around it. For example, the bladder that sits on top, the rectum that sits on the bottom, well, behind it, I should say. So once we've gotten that scan, then we're going to take measurements of your body, because everybody's shaped a little different. Everybody's a little bit different thickness, and we've got to customize that treatment for the size and shape of your body. Once all the x-rays have been okayed, then we're going to give you some special tattoos. They'll look like little moles, about 5 or 6 of them, to mark the center of one where we want to treat, the top, the bottom, and the sides. We use that on a daily basis to position you on the table when you actually come for your radiation at the same time. It's so that you're set up in the same position each time, because the position you were in at the time of the simulation is the basis of your whole treatment plan. So that procedure should take no more than about a half an hour. At the end of that procedure, we'll give you the date and time that we're going to start treatment. Now, radiation is given on a daily basis, 5 days a week, Monday through Friday, at the same time every day. And of course, depending on what part of the body that you're being treated to, depends on how long your treatment will be. So the treatments can be as short as 4 to 5 weeks, or it can be as long as 8 weeks, okay? Important things about...
I know this is important, but how am I going to remember all this stuff? Stay awake, Ralph.
Except you're laying down and the machine rotates around you.
Oh, so you feel nothing at all?
You feel nothing at all. The time the actual beam is on giving you your treatment is usually about 7 to 10 minutes. It takes another 5 minutes to position you according to your tattoos. If we're taking any special CAT scans to verify your position, or an ultrasound, depends on the organ of the body you're treating as part of your setup, then it takes a few minutes longer. But most people are off the treatment table within a 15 to 20 minute period. Okay?
Yes, ma'am.
So again, what are your potential side effects? Well, like in your case with prostate, all your side effects are going to be in the area where the prostate was. So you're not going to lose any hair on your head if you had any. Sorry.
Well,
you're not going to get sick to your stomach. You may lose some of the hair in your groin region, but most people don't complain about that. The first 2 weeks of treatment, really, you don't feel much of anything. The last 2 weeks of treatment are when you may develop some tiredness. The coming and going every day, and the body working with the radiation to try and kill any cancer cells that may still be in the organ can sometimes make you a little bit tired. So one of the things that we ask you to do to help offset that, which is very important, is to exercise, some type of cardiovascular exercise, about 30 minutes, 3 times a week. Nothing high energy. You're doing low to moderate intensity, such as walking, riding a bike, swimming, walking in the pool, dancing. Just try to do something a little bit different. Also, in men and women, as you get older, your bones can sometimes thin, so adding light weightlifting also helps, okay? And the exercise helps to offset the tiredness.
There was some more explanation, and there was time for questions. I'm going to ask her just this one.
is the kind of treatment that you're giving here a generalized treatment for all different types of cancer?
Yes, it is. It's a standard treatment. We have standards. There have been many studies done through the years looking at each type of cancer, because different cells have different sensitivities to cancer treatment. Some cells respond better to radiation, some to chemo, some need both to get the best response. And for each cancer type, there's different doses of radiation and different sensitivities.
Wonderful. Okay, I appreciate that. Well, I appreciate the explanation. It's going to be very helpful for me.
That wasn't so bad. She didn't rush through the explanation. She spoke more or less in plain language. And most of all, she didn't scare me. Instead, she just let me know what to expect from the radiation setup and treatments. She also let me know that we could have some really positive things happen. I'm going to spend some 39 days here, waiting for my turn in this room, and meeting some of the nicest, positive men I have ever known. People who are far worse off than I am, and who still have hope. Young and old, working and retired with kids and grandkids in tow. I don't have to wait 5 minutes to be called. They're pretty prompt down
Good
here.
afternoon, Mr. Stillwell.
Yes.
Hi, my name's Rod from Deer Simulation. You come on back, we'll give you a little explanation about what we're going to do this afternoon.
Sounds good to me. Thank you.
You're down the hallway to your right, please.
All right, thank you. Will we take my jacket off?
Sure, probably be a little bit more comfortable. And we can also take your glasses if you'd like, because you're going to lie down eventually. Thank you very much. Now I'm going to take a facial photo for your chart for identification. That way when you come back, the therapists know who you are.
Okay.
Take a quick facial photo. Very good, thank you, sir.
Oh, look at that.
Alrighty, what we're going to do today is called the simulation. This is a treatment planning stage for the radiation therapy to your prostate area. Our goal today is to come up with a plan that they're going to use each and every day for the treatment. The plan itself is going to be based upon the CAT scan that we're about to do. In order to use that plan, however, we have to make sure that your body's in the same position daily. To make that position reproducible, we're going to keep it nice and simple. Eventually, we're going to lie you back on your back, hands comfortably across your chest. You'll be holding a little ring to support your hands, and so your hands are up and out of the treatment field. Then we're going to put your legs inside an immobilization sponge here and band your feet together with a big rubber band as a reminder to hold nice and still. Then we're going to do a preliminary scan. The doctor likes to make sure that...
Nice guy. A gentle giant who makes you feel like someone has just thrown a warm blanket around you. We have some small talk, and he leads me back to the waiting room.
A couple of things we ask the patients to do before they come in for their radiation therapy. One is to fill this up and try to drink half of it before you come, and then drink the rest while you're in their waiting room. We like for the patients to have a full bladder before radiation, and also try to have a bowel movement either the day before or the morning after, because you need a full bladder and empty rectum. The other thing is that we ask you to watch the foods that you eat. Certain foods cause gas, and we don't want it to be bloated in that area. So I'm going to give you a list of foods, because I know patients can't usually remember what you said not to eat or anything, of the things that you need to be kind of mindful of not to eat before your radiation therapy.
Okay.
And also, we have a parking pass for you. You'll get a parking pass.
I won't have to pay for parking?
You won't have to pay for parking.
Oh my
Once
goodness.
you're done with your therapy, stop at the desk. Either the nurses or the receptionist will give you a parking pass.
Okay.
Okay.
All right, sounds good.
That's it.
Well, thank you, Benita. I appreciate it.
You're welcome.
Okay, so I get the bottle, huh?
You get the bottle.
Okay, shake hands too.
And you get a note.
And my note.
So we'll see you
All
first
right.
thing in the morning.
Okay, yep, I'll be ready to go.
All righty. You have
Thank
a wonderful
you so
day.
much. Okay, bye-bye now. Bye-bye, ladies.
Bye-bye. Have a good day.
Thank you.
There's certainly some nervousness, and I've consulted with my children, who are all supportive, and I even called my doctor friend to report on what I heard. He says, go for it.
Sir, how are you today?
Now we skip to the first day of treatment. It's a little scary. The dark garage and the ramp seem like I'm on the last mile. But I have confidence that many others have traveled this road before me and have done well. The statistics I have studied in the last few days have given me a fighting chance to beat this thing. It's amazing what modern technology has offered us to extend our lives, and I've got to be positive. You'll notice that I have reserved parking with other oncology radiation patients, and that I leave a pink card on my dashboard. I might as well get used to the trip down here. It only takes 30 minutes on the expressway, and there was little traffic. They offered me an alternate location, but I must tell you that the people here got to me. They were making me feel welcome. The entrance to the garage, parking, and elevators are conveniently located near the oncology unit so that the patient does not have to walk far. Wheelchairs are there for those that need them, and we enter the magic doors.
Hi, how you doing today?
How are you today?
Fine, thank you. Gorgeous weather out there.
Got to be out there with you. Yeah, so right around to the men's waiting room, and I'm going to meet you.
All right, thank you very much.
Have a good day.
Thank you. Hello.
I'm Janan. I'm one of the radiation therapists here. It's nice to meet you.
Thank you.
You're ready for your treatment?
I am.
Okay, we're going to go back to the treatment room.
Fine, I will follow you.
Have you prepared?
Oh,
your-
yes, I did. I drank all my stuff.
What we're going to do today is line you up like we did in the CT room on your first day.
Yeah.
And we're going to administer your radiation therapy treatment.
Okay.
Okay,
Now, they promised me this wasn't going to hurt.
Oh, I will keep that promise.
All right,
I
sounds
have a
good.
few other therapists for you to meet. This is Kathleen.
Hello, Kathleen. I'm glad to meet you.
Nice to meet you
How
too.
do you do?
Robert.
Robert?
Nice to meet you.
Nice to meet you.
We're going to explain the procedure and we'll go from there.
Please.
Okay, what we're going to do, Mr. Stillwell, is we'll have you on the table, line you up. We have 2 monitors that we watch you on, and also an intercom system, because we don't stay in the room with you while you receive your treatment. But we do keep a good eye on you, so if you need anything, just wave or call out and you'll come in, okay?
All right, so you're watching me.
Yes, sir.
That's
Now-
good news.
Now, every day when you come for your treatment, we're going to ask you what your birth date is. So if I could have your birthday, please.
12/9/39.
Okay, you're who we want.
Yeah? Okay,
Great,
sounds
thank
like
you.
a deal.
All right.
Thank you.
And come right in.
Okay. Wow. Here I go. I'm scared again. I know they told me I wouldn't feel anything. Now I have 100 questions. What kind of a machine is this? How much did it cost? Is anyone staying in the room with me? How do they contain the radiation in this room? Will the beam burn me? What if I need to go to the bathroom? Look at the size of this thing.
Your legs are going to swing up into the sponge, okay?
Yes, sir.
So Janarman's going to help you with your back, and I'm going to help you with your legs.
Okay.
When you're ready. Ready? Sure. All right, here we go.
You just kind of square yourself up on the table there.
Up.
Nope, you're good.
I'm good.
I'll adjust this underneath your head a little bit, okay? So go ahead and lift your head. Lay it
Okay.
back down.
And I'm going to have you hang on to that. We'll put a rubber band around your feet so you don't run away on us.
That'd be wonderful.
Okay.
So the table's going to come up and underneath this machine, okay? The machine rotates around you from all different angles. It comes close to you, but it does not touch you. During your treatment, you're not going to feel anything or see anything. You're just going to hear a buzzing noise, okay? We dim the lights in the room so we're able to see the laser system that we used to align you to the marks that they gave you during your scan, okay?
Yes, sir.
Radiation is emitted from here, okay? So go ahead and dim the lights.
Okay. Now Robert has you lined up on his side. I'm going to move you a little bit so we can get you perfectly lined up, okay?
Yes, ma'am.
All right.
Your only job is to lay nice and heavy and hold still. Try not to move.
Okay. That looks good. And we're reading 84. Okay, thank you.
Okay, so now these arms are going to come out on the side of you. And what we're going to be doing is taking a mini CAT scan, okay?
Yes. I can't believe it. The fear has totally left me. The treatment was very, very interesting, but not scary. And I'm anxious to go on with this and learn more. All questions are answered. I feel nothing and only heard pleasant music during the procedure. Oh, there'll be some fatigue, the drive back and forth, the hour of the day, my wish to eat, nothing bad, more trips to the bathroom, nothing I can't live with. I can't believe that the time has gone by so quickly. I just underwent 39 treatments. I'm finished? Don't come back tomorrow? Get a clean bill of health from the doctors? Did I pass my tests? Am I cured? The best part of all this is that I feel great, both physically and emotionally. I have no cancer, at least not now. I have a new lease on life. I can kiss my children. You know what? I need a big lunch.
Mr. Stillwell, I'm very excited to be able to present this certificate to you on your very last day. This is from the Department of Radiation Oncology to you for finishing, and let me read it to you. This is to hereby certify and acknowledge that Ralph Stillwell has completed a course of treatment in the Radiation Oncology Department on this 4th day of May 2012. This further acknowledges that the above named patient will no longer be required to fight the traffic or the weather to be present for treatments and is qualified to plan various other exciting activities to fill his day. Congratulations and best wishes from all of us.
Thank you. Thank you very much. This has been a real pleasure. I have to tell you, it has been a pleasure. And I will miss this place tremendously.
And we will miss you.
Thank you.
Very excited you're finished with your treatments, though.
Thank you very, very much. I think it's not unfair to say that what you have done is you have saved my life. And that's not a small deal. So know that you are very, very special people. Very special people. Each and every one.
I want to talk to some of the caregivers. I have some questions about them and what they do. I want to start with Lakeisha. She was one of the ladies who greeted me when I first came in.
Lakeisha, it's so nice to see you again.
You too.
Tell me, Lakeisha, what is it that you do here?
I'm the receptionist. I greet the patients, make appointments, and check the treatment patients in, and try to make everybody feel welcome.
And what gives you that spark to do that? How do you get up in the morning and say, I am going to have a smile on my face today, and I'm going to make everybody feel good? How do you do that?
Our patients, knowing that they're going through a tough time in their lives, and just knowing that a smile here can make them feel better, and greeting them with a warm greeting, and just make them feel as comfortable as possible. And it helps me get up and come in here and do it every day.
I think it's great. There are patients who have different outcomes here. I'm sure you're very much aware of that. I came in here and I got lucky. Okay, Some people don't get quite as lucky. How do you handle that? Because you see a lot of that.
Yeah, we've seen some cases. Just keep going on, knowing they're in a better place, and we did, what we could for them, and just knowing the relationship we built with them when they were here with us.
Mm-hmm. What advice would you give a family member if you knew that they needed to have radiation?
To come here. Come right and see us. We'll take good care of you.
So you can say that with conviction.
Oh, yeah. I've told people that before.
You told people that before?
Yes.
So you're part of the bottom line in this hospital, aren't you? All right, I got to ask you one last question.
Sure.
Okay? And this is the killer question.
Uh-oh.
Are you ready for this one?
Ready.
Okay. Someday when you retire, which I hope is a long, long time from now, what do you want people to say about you?
Good question. Just want them to, I hope I did my job and they felt comfortable with me and I was able to help them out any kind of way I can.
Well, all I know is I came here for a long time and I miss you guys.
Oh, thank you.
That's how you made me feel. Thank you so much for coming in.
You're welcome. Thank you.
Bye-bye now.
Bye.
Bonita was the nice nurse who gave me the water bottle. If anyone sees the fear in us, she does. It's the last line of defense before the doctor comes in with her pronouncements.
Well, hi again, Bonita. I'm glad that you're here with us. And being the nurse that you are, it puts you in a very, very unique position. Tell me something. What do you really do out there?
Well, one of our main tasks is try to make patients comfortable. You're already coming into a very stressful situation. You're given a lot of information. Some of it you hear, and some of it you don't. So, and you're going to be coming here for a couple of weeks. So, we try to make it as comfortable as possible for a patient, with also being informative to give you the information that you and your family will need to get through this trying time.
Now, before, when we were talking earlier, you started, I can't ask you what should people expect of you, because you really gave me a very, very thorough explanation of the process and what to expect. What do you tell people who come in who are perhaps, well, maybe not quite as ready to hear as perhaps I was?
You try to assess where they are, what level they're on, and just give them what they're ready to hear. Nothing extra, because it'll all come in time. So, you just try to, fill them out with just basic questions. How long have they been seeing the oncologist? Is this something that's been going on for a while? or, just you kind of get to wherever their level is. Because everybody is different. And I know patients talk when they are out in the waiting room, and so they're like, oh, well, this is what happened to me. Well, everybody's different. So you got to really try to listen, which is the main thing that nurses need to do, is listen and, kind of feel where the patient is.
When you retire, what do you hope your colleagues and your patients would say about you?
That I was a good nurse, that they remember you. If a patient remembers you, that means you made an impression.
When you have to deal with somebody who's perhaps not going to get better, how do you handle it?
Me personally, I try to find out if they're a religious person, because not everybody's religious. So, if they are, I just tell them to be prayerful. God doesn't take anybody before their time. And so, but if they're not a religious person, I just try to tell them, to stay positive. We all know that we're not meant to be here forever. And so sometimes we just have to come to grips with that and just try to listen.
And be a friend.
Right.
And be a good friend. Thank you for Benita. Thank you for being you.
Now let's talk to Zena. She's a dosimetrist, whatever that is.
Well, hi, how are you, Zena?
Good. How are you, Mr. Stowell?
Fine. Would you tell us just who you are and what it is you do?
Okay. My name is Zena Alloway, and I'm a medical dosimetrist. And what I do is we do the treatment planning for the radiation. So after the CAT scan is done, what we do is the doctor marks, and then once he marks, he gives us the prescription, and we kind of create the plan from there.
I see. So you have to do with all those little dots that they call tattoos?
Yes, this is the doctor marks it from there, and this is what we plan. Around those dots is where we generate the plan that you're being treated to on a daily basis.
What advice would you give a family member if he or she was a potential patient in radiation oncology?
I actually have family members who've had cancer, and it's one of the reasons why I'm so interested in this field and I got into it. My advice to them is just to kind of always get screening on a regular basis. And if you're the person who has cancer, just live your life like any normal person to the full potential that you can, and just be who you are and do your life, go about your life like a normal person does.
That's very good advice. Because of the audience that we have, tell me, what do you think is important for our viewers to know about cancer treatment and cancer outcomes?
Cancer, unfortunately, we're seeing it a lot more these days than we did 10, 20 years ago. I just want people to know it's not, like, as soon as you say the word cancer, a lot of the people say, like, it's a terrible thing. It could be, people can live normal for many, many years. It could be a curable disease. That's why it's important to constantly get the screenings that are out there for us. Yeah. It can be like any other disease.
So what you're telling me is that the word cancer does not and should not be a death sentence.
Correct.
Live your life to its fullest potential. That's what she said. People are living longer, and there is lots of hope. Maria is on her way in. Talk about a positive person. Listen to her.
Hello, how are you?
I'm doing great, thank you.
Would you mind telling us who you are and exactly what it is that you do?
Sure. My name is Maria Bellin. I am a senior associate medical physicist here at Henry Ford. I've been here for about 3.5 years, and basically, as a clinical medical physicist, the most important aspect of my job is to ensure that every patient receives the most accurate and the most precise treatment in the safest ways possible. So, we're working with all members of the radiation oncology team to make sure that that happens. But our contribution happens more behind the scenes, I would say. So we're responsible for performing quality assurance on the equipment, on the treatment machines, and this involves us, testing certain functionality of the machine, as well as measuring and calibrating the output of the machine on a regular basis. And this is so that we can verify that it's meeting specific standards. We also we do quality assurance on the patient treatment plans as well. And this helps us check whether we are, whether the planned treatment and the actual delivered treatment match as exactly as possible. Medical physicists are also responsible for helping introduce the latest and greatest technologies into the clinic.
On a little lighter note, why did you choose this profession?
So going into healthcare actually was something that I knew I wanted to do very early on. And so when I was in high school, I had this really crazy, funny, nerdy physics teacher. And so that's where I gained my initial interest in physics. Then I started college and I majored in physics with the intent of eventually going on to med school. But about halfway through my college career, one of my mentors introduced the career of medical physics to me. So I started looking into it more, and after doing a little research, I realized it was kind of, for me, the best of both worlds because it had the physics aspect as well as the medical aspect and the healthcare aspect. So,
you find you have a good balance between your professional life and your personal life?
So that's tricky because it's something that I struggled with probably the first year that I worked. This is my first full-time position. So basically what it ended up coming down to was, when I say that we work more behind the scenes, I mean that we're here working more after hours. We may sometimes, even spend the night here if that's what it comes down to. But, what it really came down to was me realizing that if I began to cut out things that made me happy in my life outside of work, that was it became challenging for me to, operate at the highest level when I was at work. So basically I just had to make it a priority to, on the days that I know I wasn't staying late or doing any after hours work, to really make a commitment to working as efficiently as possible while I'm here at work. And that way I can enjoy my time outside of work.
That's good. I guess one last question would be, how do you feel about dealing in an area where there is so much question and fear and running back and forth to hospitals and doctors? How do you feel about being involved in all that?
Well, I'm very fortunate in the sense that I have a lot of very positive people in my life. So that helps me, myself, be very positive and try to enforce that on other people. And yes, it is a very, very tough situation, especially for the patients and their families. But working in this field, you're always in some way, have been touched by someone that that has had cancer, or a loved one, a friend, or yourself even. So basically, you just have to. I just believe every single day that I'm doing the best that I can do, and I try to encourage people to be very positive about their situation.
Well, I think you've done an amazing job with that. I really do, and I am so glad that you have calibrated that machine to do the right job, because that's how come I can be sitting here today.
Great.
So, Maria, thank you so very much for being a part of this, and thank you for being a part of the people who do the work you do.
Thank you.
Thank you.
Told you. Apparently, many of these folks find that fine balance that she spoke of and make sure that their priorities in life include just how to make our lives better. Now comes Jinan. She was very special in caring for me. Let's hear her opinion.
Hi, Jinan.
Hi,
it is so nice to see you again.
Nice to see you
I
too.
have had such a wonderful experience in this place and in your department. But I have to tell you that there are 2 or 3 of you that are really, really more than special. You're all special, but even more than special. And I have to tell you that you were one of those people where I really felt that I had to come here, I had to be a part of this, and that you were a direct contact between me and whatever is out there that made me live.
Thank you. I'm glad you feel that way. We
Thank
really
you.
try our best, and obviously it reflects in you.
What makes you do what you do? What makes you so exciting in creating relationships with your patients? What is that spark?
Well, I feel like it's rewarding. It makes a difference. This is what I've always wanted to do as a child. I wanted to be in healthcare, and with cancer being out there in everybody's families and friends and circle, I feel like it's the best place to be and to help people out.
Just to help people out,
Yeah.
huh? Now, you have several children of your own.
I do.
You have how many?
2.
Two. Okay.
A girl and a boy.
And they love Dr. Seuss books.
They sure do.
All right. I'm so glad because we did that, didn't we? All right. Your group really exhibits such a sincere caring for the patient. Can you kind of describe how this came to be?
That's true. I work with an excellent group of people that show professionalism and empathy towards the patients. And that's because we see them go through this every day, and we want to be a part of their journey to recovery. And so many of us have seen cancer in our group of friends or family members, and every day as we come to work, and we want to make a difference as we come here. So.
Have you ever worked for another health organization?
I have. I've worked for one other than Henry Ford, and I've seen many institutions as a student.
How is it different?
At Henry Ford, there's great emphasis on customer service. We have, as you might have heard, we just recently won the 2011 Malcolm Baldrige Award, National Quality Award.
Yes.
And that's a great prestige for us. And we have, for the staff here, we have classes ongoing at all times so we can grow. And our supervisors, they have meetings with us on employee engagement all times so we're able to grow and improve.
How does your family view you being in this?
My family's very proud of me. It took me a while to explain to them what I do, and they worry about me being exposed to radiation, but I explained to them we wear these film badges right here, which monitors our radiation exposure, and I assure them that there's nothing to worry about. But they're very proud, as I'm one of the first people in my family to graduate from university and go into this field.
Okay, I need to ask you a trick question, and I frankly did not have this in here. And if you do not want to answer it, please tell me so, okay? Because we have such a large Arab population in our audience, what message can you give them that will make them feel more secure when they find themselves in a situation where they are a cancer patient? What can you say to them?
I would tell them to live every day to their fullest and to try to find the best institution that will help them heal and cure and be there for their family and their friends. And come to Henry Ford. I'll be here, and I'll be more than happy to do the best in my profession as I did with you, as we do with every patient that we treat.
I know it's a strange thing to say, but I miss coming down here.
We miss having you. You are unique.
Thank you so very much for coming in and helping us do this. And please give your children my best.
Thank you.
And tell your family that they may be very proud of their lady.
Thank you very much.
I did want to ask Dr. Walker a few questions to wrap up these interviews. She's a wise woman and a good physician. Doctor, thanks so much for coming in. It's a pleasure to have you here. And I have to tell you that one of the things that impressed me about this place so very much in my own treatment was the way the physicians treated me. There was a way in which they were honest, forthright, and I think the word is really caring. So I guess the first question I really want to ask you is, what inspires you in your job? You know, how do you keep a positive attitude when there is so much negativity out there? You are here doing a wonderful job, and what really is your turn on here?
Well, I think, first of all, I have a great faith in God, And so I try to express that and give that to my patients also, because it's been shown in many studies that some spirituality and belief system helps patients to get through their treatment better. And in my daily care of patients, I'm going to treat you like I'm going to treat a family member, and as I expect people to treat my family members. And so if we don't look at the positive side of things, you know, for everything that's going on with each of us, and patients in particular, there's somebody who has something a little bit worse. So if we can try to keep a positive attitude and look at the good side of it, I think that's what helps patients.
Interesting. Very interesting philosophy. Tell me, how many times do you actually get to see the patient? Now, when I was here and they introduced me to this unit, I had to come here 39 times. And that's a long time, 39 times. How many of those times should I really be seeing you?
Well, I mean, this at least once a week you're seen by your physician. To see how you're coming along with treatment, because we want to monitor as you're going along. When we talk about side effects of treatment, we're trying to minimize your side effects. So by seeing you at least once a week during your actual treatment, it's important to help prevent those. But also you generally see your doctor at consult, you see your doctor at the simulation procedure, you're going to see them towards the end of your treatment to do any closeout that you may have and to tell you about your follow-up, the expectations, and what the plan would be, your survivorship plan for the following year at least.
I guess I can skip that question then, can't I?
Which one?
Because that was on my list, you know. Do you feel it's important to give patients every detail about their condition and their treatment?
Well, I think what's important is to make sure the patient has a general understanding of what's going on with them. So I use the technique of teach back. So if I tell you something, then I'm going to ask you to tell me what we've discussed. Now, some patients want to know great details, and for the patient who wants to know every little detail, possible detail of their treatment, then I will give that to them. But most patients want a general understanding. They want to know what are the most likely side effects, the most likely outcomes from their treatment. So I target it to the patient.
Can I ask you, and this is a little bit sensitive, of course, but what do you tell those people, or how do you behave with those people where everything's been exhausted and there really is no good outcome? What do you tell them?
That happens often. As patients, you know, the good thing is today, people live a lot longer, even when they have stage 4 cancer, which is considered incurable, but definitely treatable still. But they do reach that point. And I think one of the things is being honest about expectations, honest about what can be done. And then also talk with them about hospice care and palliative care, because choosing hospice is also a choice. When you reach that point in your treatment, you're choosing to be peaceful and to not have pain and have some quality of life towards the end. I mean, I personally have had to face that with my parents, so it's not an easy choice for anyone, but it is actually a treatment choice, and I consider that a treatment choice at that time.
All right, I'm going to ask you one last question here, and I think this is perhaps the most important of all. When you retire, which hopefully will be a long time from now, but when you retire, what do you hope people will say about you and your physicians here?
I think they say it already, that we're very compassionate and caring towards our patients, and that's what and they help them. And they learned something from us.
All I can tell you, Doctor, is that in all the time that I was here, I think what you said was very, very true. And I'm proud to have been here and been a patient of yours.
Well, we were very happy to have you, and thank you for doing this.
Thank you so much.
You need to know what kind of coverages you have. Here in America, we have insurance. And you need to know what you're covered for and what you're not covered for, either under the private plans or under Medicare, and the supplements. You also need to be aware about the patient advocate wills, which in many places are called living wills. so that you can put down your wishes and they can be carried out. And you also have to have the HIPAA forms signed so that your relatives, your dear ones, can find out what's going on with you. That's the law here, so you got to do it right. But let me make some important points to you yet. You know, there are 1,700 doctors here at Henry Ford, and there have been 5,500 robotic prostatectomies successfully done here, more than the rest of the world combined. There are lots of success stories. There are 25,000 employees with 5,168 nurses from 63 different countries. 89,000 surgeries were performed on over 101,000 patients just last year alone. And 7,400 of our grandchildren were born here last year. Cancer is curable, but you have to help. You got to read up on it. I used Prostate Cancer for Dummies, and my children dug out plenty for me on the internet. Don't ignore your symptoms. Explain them fully and list all the drugs, whether they were prescribed or you get them over the counter to the doctor. Tell the doctor about family history. It plays such an important role in the diagnosis and in the treatments that they recommend. Make a list of questions. Take someone with you. You're liable to forget some of the details, and an extra set of ears never hurt. Also, if you don't get satisfaction on the answers, get another doctor. In fact, get 3 or 4 opinions. Your life could depend on it. Know that impotence, which we know as ED, can be helped, and that you don't have to give up sex or wear pads for the rest of your life. That once-a-year exams are not too much. The digital exam, just like the other tests, ultrasound, MRI, CAT scan, biopsy, bone scans, aren't painful. Banging your head against the door is a lot more uncomfortable. Know the Gleason score, the staging. What does metastases and seminal vesicles, what do they all mean? Too much knowledge is never bad. While we're at it, support groups are not made up of whiny old men feeling sorry for themselves. They each have stories to tell, and you will find the folks becoming friends, helping each other through some tough times. Most of all, they can deal with something that we call fear, something we hate to admit. There are also social workers who help you plan for future services. They're there to help you. All your doctors at Ford meet once a week on what's called a tumor board, where they discuss your particular situation and come up with a continuing treatment plan for you. With thanks to the dummy book, don't be a Mr. Do-Nothing and ignore your symptoms. Don't be a Mr. Worrier who mistakes worry with caring for yourself. Be a Mr. Need More who researches and asks for opinions. And be a Mr. Action who decides to fight for your life. The rewards are great. Just look at your families and the sunshine outside. You need to be examined each year. Anybody who has had prostate cancer will tell you that. Know what your insurance will pay for, especially with Medicare, Medicare supplements, prescription coverage. Don't be ashamed to talk to your wife, your kids, your doctor, or anyone else that is close to you. Make sure that you've signed patient advocate wills and HIPAA forms. This is to make sure that your wishes are carried out and that the right people can get information about your condition when you're under medical treatment. Most important, if English is not your first language, make sure someone translates for you, or you ask the hospital or the doctor's office to help you get someone to help you to understand. Mistakes can be very dangerous. Last but not least, I have a saying you might want to remember. Desperation and fear walked in here, but hope and dignity walked out. Thanks for sharing this evening with us. Be sure to get your families and friends to watch the repeats during the next few weeks. I dedicate this show to you. You deserve nothing but the best. Good night.
Camera rolling.
Hi, all right. Mr. Brahms will have to wait.
Camera rolling.
Lakeisha, welcome. What, they were twins?
Yes.
That's a good luck.
If it goes off one more time, I'm going up to sell some life insurance.
Prostate was. So you're not going to lose any hair on your head if you had any. Sorry.
Okay, go ahead. Rolling. Rolling.